I'm going to be your nurse today. I'm going to go ahead and provide us some privacy here. Mr. Jones, so I have an order from Dr. West to obtain a wound culture from your incision and to also perform a sterile dressing change on you. Is that okay? Yeah? Okay, great. Can you verify your full name and date of birth for me? George Monster Jones, 101XX. George Monster Jones, 101XX. Verify that against your arm bracelet. George Monster Jones, 101XX. Okay, perfect. Mr. Jones, so are you allergic to tape, iodine, or latex that you're aware of? No? Okay, great. And as far as pain, on a scale from 0 to 10, with 0 being no pain at all, 10 being the worst pain that you've ever experienced, how would you rate your pain today? A 0? Okay, great. All right, so I'm going to go ahead and perform hand hygiene. I'm going to lower the side rail here. I'm going to raise the bed to a good working height. I'm going to go ahead and just expose the dressing area a little bit, okay?
Well, and that's fine. It's not a bad habit.
All right, and I'm going to go ahead and get my bag ready here.
It's not a bad habit. It's just not.
I'm going to put this in between your legs, okay? So that I can place my trash in there.
She could have been done.
All right. And hand hygiene again. I'm going to put on some clean gloves here.
So let me see that part of your video. Okay. My phone's open.
Yeah, and I'm literally like,
You're not wrong.
she was doing it over the field, cause like
All
I
right.
stepped back and stayed
Now,
there, and then I was
before I take off the dressing, I'm going to go ahead and assess it first. So I don't see any drain, exudate or no erythema around the edges, and there's no odor, and everything looks to be intact. So I'm going to go ahead and take this off now. You let me know if you have any pain at all, okay? Alright, so now on the inside I do see a scant amount of pink serosanguinous exudate. Again, there's no odor. So I'm going to go ahead and throw that away. And I do notice a scant amount of exudate down here at the bottom of your incision, and there's 1, 2, 3, 4, 5 staples. It appears to be well approximated. There's no erythema or edema. All right, so I'm going to go ahead and assess for any warmth now. Just going to gently palpate here. Okay, there's no warmth. Now I'm just going to gently palpate around the incision for any induration. And there is no induration. And like I said, there's a scant amount of exudate down here at the 5th staple. Now I'm going to go ahead and change my gloves for hand hygiene.
I watched over it so it went directly, like it didn't go back.
So now I'm going to go ahead and clean the incision area, okay? And before I do that, I'm actually going to go ahead and measure it. And I'm going to stay about 1 inch away.
So that's where you
Okay, and it's approximately 6 centimeters. So I'm going to go ahead and discard of that. All right, so now I'm going to go ahead and open my sterile gauze here.
Sterile to that and went in the one. But that's because you had all this other stuff.
So I can just turn, I'm gonna just turn my fingers back and I'm gonna just throw the saline.
I'm gonna toss it.
Yeah, I'm gonna toss it
Here.
Why do you think I'm so, why do you think I'm so defensive?
So now I'm going to go ahead and grab my sterile saline here. Make sure that it is within expiration date, and it is. It has not expired, and it's within a 24-hour time frame of when it was initially opened. I'm going to cup the label here. I'm going to place this here on the table. I'm going to lip the saline. Now I'm going to just place a small amount of saline here on the gauze to moisten the gauze. That back. Now I'm going to grab the 4 corners here of the gauze. Okay. And I'm going to start cleanest to dirtiest, and I'm going to go down the middle first. So middle, turn my gauze and go away, and then turn my gauze and go down near. Throw that away. Grab my dry gauze here. And I'm going to pat dry again down the middle here. Turn my gauze away, and then turn my gauze and pat dry near. Okay, discard of that, discard of this. Now I'm going to obtain my wound culture here. I'm going to open my packet, discard of this. Take the top off of this here. Now I'm going to gently place the culture swab down here at the place of exudate for about 5 seconds. Okay. Now I'm going to place the culture swab into the tube, making sure not to touch the outside edges. And I'm going to make sure that the patient's label is on here with the patient's name, date of birth, time, place of the incision, which is the abdomen, and my initials. I'm going to place this here in the biohazard bag so we can send this off to the lab. Okay, now I'm going to dispose of my gloves. I'm going to perform hand hygiene. Now I'm going to go ahead and open my sterile dressing tray here. I'm going to go ahead and peel this back, fold this under, making sure not to touch the inside of it. I'm going to open my sterile gloves here and dispose of that. Okay, now with my sterile gloves, I'm going to start away, near, and then open here in the middle, making sure to stay within the 1-inch border. Now I'm going to grasp my glove here and step back. Place my glove on here like this, cuff up underneath here with this hand, step back, place my glove in here. I'm going to fix the fingers there, making sure that I only touch the sterile part of the gloves. Now I'm going to get rid of that. I'm going to get rid of any items that I don't need. So I'm going to place that here in the waste. And I'm going to go ahead and grab my betadine swabs. I'm going to tear this open here. Now I'm going to go ahead and clean Mr. Jones, okay? So I'm going to start down the middle. Throw that away. Away. Throw that away. And near. And I'm going to throw that away. I'm also going to throw this away. I'm going to reach around here and I'm going to grab my bandage. I'm going to place that there. And now that I'm no longer, I'm going to take my gloves off. No longer sterile. Throw that away. Perform hand hygiene. I'm going to go ahead and take this down with a window pane seal, okay, Mr. Jones? Make sure that that dressing stays on good. Okay, and now I'm going to go ahead and write my initials, date, and the time. Okay, I'm going to take that on here. All right, Mr. Jones, I'm going to go ahead and cover you up now, okay? All right. I'm going to dispose of my garbage in the appropriate garbage receptacle. I'm going to dispose of any instruments or any other garbage that I've used today. I'm going to make sure that your call light is in reach, so you just press that if you need anything. I'm going to raise the side rail, lower the bed back down into the lowest position, and perform hand hygiene.